Drug treatment specialists will tell you there is not one single cure for opiate addiction. Some recovering addicts have great success on the treatment drug Suboxone. Others are taking a different approach called Vivitrol. Investigative reporter Miranda Combs introduces us to two men taking two different routes to recovery.
It wasn't a good day for construction or even an interview. But the story this construction worker has to tell parallels the storm.
There was a hole inside my soul, so, you know, I've done a lot of, I just did a lot of things I wasn't proud of.
It controlled him for years.
I never dreamed I'd be sober. Honestly, I thought I would die, a drug addict.
Robert Pearson ended up at Lifecore Recovery in London, where they specialize in using Vivitrol, a drug treatment medication that isn't a narcotic.
Which I haven't had any cravings or thoughts of using, but I also remember what it was like to walk through that hell. The
hell he's referring to is his detox.
I was evil.
It's rough. I mean, it's hard to describe.
This is Jesse Howard.
It's like the flu, but much worse.
He's going through detox right now.
Like if somebody touches me, I don't even like it. I don't even like my skin.
Why'd you come in as opposed to staying out?
Well, my wife was, I mean, it had escalated. It got worse and worse, you know.
We sat in while Dr. Stephen Lamb, a drug treatment specialist in Lexington, slowly started introducing Suboxone.
There you go.
A different opioid treatment drug to Howard's system.
Keep it under your tongue for at least 6 minutes.
Every 30 minutes, he was evaluated to see if more Suboxone was needed to get him back to feeling okay.
Like heart rate, pupil size, bone and joint aches, runny nose. Are you having any trouble with your stomach?
Nope.
After 2 tries, Howard was feeling better. He'll stay on Suboxone and go to therapy sessions for the foreseeable future.
I mean, it's not just like you take the pill and that's it. You know, I have to go to meetings.
This is not his first time on Suboxone, and this isn't the first time we've covered this controversial opioid treatment option. Law enforcement has told us it's the most highly abused drug in southern and eastern Kentucky right now.
There are problems and mistakes, but again, I don't know what else to do. If I did, I'd do it, okay? And yet, I know it works when you do it right.
Dr. Lamb has been prescribing Suboxone since 2003. Along with therapy, he says it works. He admits the patients aren't completely clean since Suboxone is a narcotic.
I can see where people would say, well, you're still taking a drug to beat a drug. You know, I can see that, but this is much more effective than just going on the street buying pain pills.
And if they get well, if they start doing well in their lives, I call that serious.
The drug problem spreads north. Head up to this clinic in northern Kentucky. They are seeing about 16 Vivitrol patients a day.
Is Vivitrol the best medical answer you have right now for addiction?
Yes, it is.
Vivitrol is a once-a-month shot. It's supposed to not allow cravings, and even if a patient tried to get high, they wouldn't feel the effects. The drug has been around for a while, but lately it's getting more traction.
I think one of the reasons why it's not more popular is just that the word's not out.
She says they are seeing 60 to 70% success rates with Vivitrol, but warn a patient has to be serious about recovery. If a patient gets the shot and has opioids in their system, the shot could send them into a more severe withdrawal.
And it's nice to be able to be part of a cure for this, because it really is a cure.
Well, I've offered Vivitrol for a long time to people. And they say it sounds good, but when the rubber hits the road, when the time comes, they say, I'm not sure I can do this. They're frightened of taking it.
See, that would scare me. I'd be afraid that all of it would come out at once and you die.
Pearson is in his 2nd month of using Vivitrol and his 2nd month of putting up siding. This old barn is an animal rescue. The barn is broken and needs fixing, just like Pearson did.
I was looking at a dog over here. It's got a broken leg and, excuse me. And I wanted to take it home with me, you know, because I was that dog with a broken leg, and now I can walk again, so.
Pearson says it's God that's kept him sober,
Already.
but the Vivitrol is comfort that he can't fall back. For Howard, Suboxone is comfort too. Two men taking different routes to stay clean and weather the storm.
In regard to Vivitrol, if you are paying out of pocket, it's going to run you about $1,000 for each shot, which is a good bit more than a month's worth of Suboxone. However, insurance does cover Vivitrol, even Kentucky Medicaid. At least that's been the experience of that Florence Medical Group that we interviewed in the story. How about two guys taking two very different approaches and being completely honest with us about how hard it is?
Yeah, that part was shocking. But the guy that's taking the Vivitrol, he says he was actually on Suboxone for 8 years. It was the worst withdrawal he'd ever been through. But then the guy that was taking the Suboxone, you heard him say, I'm scared of Vivitrol. So very interesting, but we're going to check back in with them in a couple months and see how both of them are doing.
Some new hope, sounds like, you know, for a lot of people.
Yeah, absolutely.
Thank you, Miranda.